Hi, my name's Ari, and I'm here to tell you about EFSim, an exciting new digital tool that is revolutionizing the ADHD pathway. EFSim is an online ADHD assessment, essentially a web game that allows children to play it within the safety of their home or in the clinic, and at the end of the game, they're able to identify what challenges they might be facing. We were originally established in Finland, where we work with over 100 schools and thousands of pupils. We also work with other university hospitals, and we work with a well-being district in Finland. This is similar to what is called an ICB in the UK, and might be called something else in the country that you work at, but essentially it is a geographic area that is controlled and funded by the government, and the government is responsible for providing healthcare to that particular area. In the UK, we've worked with over 40 schools, and that has led to us doing that larger ITV pilot with a geographic area I spoke about earlier, and we work with several private practices and nonprofits across the UK. We are also certified and approved. We've got a CE certification as a Class 2A medical device, ISO certification, we've got UKCA in DTEC, we're about to get a patent, and we're also ORCA certified and soon will be listed on their database. The benefits of EFSim is that it's massively scalable. Because it's a web test, all that you really need is a computer and internet access, and you're able to test the child really anywhere, either at home or in the clinic, and you get the results automatically via the EFSim portal. It's also objective. At the moment, a lot of questionnaires are having take hours to do, and the questionnaires can often be subjective or biased, whereas EFSim is unbiased and it's focused on the data, and it's really helpful for supplementing those more questionnaire-based assessments. It's also reliable. We've done quite a lot of international research, and if you're interested in seeing more research about what we do, there is an FAQ that can be sent to you afterwards. And it's quick. It does not take long to diagnose or evaluate a child and allows clinicians to prioritize their waiting list. So the way that EFSim works is that the child performs the EFSim test, which takes about 25 minutes to do and can be done on any kind of computer that has access to the internet. As soon as the test is completed, reports are generated automatically, and those allow clear and immediate insights to the family and professionals immediately after the test. Now, the big benefit of the reports is that rather than a simple yes or no answer regarding ADHD, it provides a really good breakdown and insight into the different executive functionings that the child could be struggling with, and it breaks it down into 3 different categories: attention and general executive function, hyperactivity and impulsivity, and planning and perspective memory. And again, this allows you to get just a better understanding. So instead of parents and caregivers feeling like they need to tackle all of the sort of possible challenges that someone could face with ADHD, they know what things to focus on. So for this individual, for example, we can see that the biggest challenges are around attention and executive functioning. They have a little bit of hyperactivity, but the biggest issue is around that planning and perspective memory. And further on in the reports, we have more strategies and techniques on how to support the child, and also strategies and techniques for the caregivers themselves to ensure that they understand how to bring challenges to a child and also manage their own emotional regulation as they're working on these things with that individual.